Welcome to the presentation, an IVR-based physician order entry system for clinical lab orders. This presentation is a demonstration project intended to describe the feasibility and advantages of a phone-based lab ordering system linked to a healthcare organization's electronic health record. Laboratory testing consists of three distinct phases. The pre-analytical phase is the phase in which the physician creates an order, the lab processes the order, the laboratory specimen is collected, usually by phlebotomy, and then the specimen is received into the laboratory. The analytical phase consists of steps associated with conducting the actual test ordered by the physician. And the post-analytical phase is the phase in which results are computed, analyzed or interpreted, and reported to the physician. Over the last several years, much emphasis has been placed on assay quality control. Subsequently, errors in the analytical phase are infrequent. The most common phase in which errors occur is the pre-analytical phase. Errors frequently occurring in this phase include patient misidentification, incorrect specimen type collected, and incorrect order entry and/or transcription. It is this last error on which direct physician order strategies have the greatest impact. Direct entry of orders by physicians greatly reduces transcription errors, if not eliminates them altogether. Recent advances rely on computerized physician order entry, or CPOE systems. In the inpatient setting, physicians may place orders directly into the hospital's EHR system. In the outpatient setting, a physician may access a healthcare organization's EHR and place orders remotely provided the physician's computer system can interface with it over a secure internet connection. However, how would a physician place orders remotely in the absence of an internet connection, or if their system does not interface with the healthcare organizations? Interactive Voice Response Systems, or IVRs, offer an alternative means of placing orders in the absence of direct EHR access. Phone-based IVR technology allows a computer to interact with a human through the use of a voice or dual-tone multi-touch frequency, commonly referred to as a touch-tone input. This proposal requires a few assumptions to be made. First, the healthcare organization has an EHR system in place. Second, physicians are registered into the EHR system and are assigned a unique 5-digit personal identification number, or PIN. Third, each physician's active patients are identified and linked back to the physician, granting the physician ordering privileges for their patients. This slide represents a simple database of patients and their physicians. For example, Dr. Steve Smith is listed along with his PIN. He has 2 patients currently registered as under his care, Mr. John Doe and Miss Susan Andrew. Each of their date of birth is listed, which is an important piece of information used to help identify the patient should 2 patients have the same name. A physician starts the process of ordering a lab for their patient by accessing the IVR system. This can be done numerous ways, including dialing a phone number or perhaps using a voice over IP system such as Skype. Once the system is accessed, the IVR plays a prompt. Hello, you have reached the outpatient lab ordering system. Your lab orders will remain on file for 30 days. At the end of this prompt, the IVR system moves to a choice step. This step recognizes inputs in the form of the physician's PIN. It asks for the PIN by stating, "To begin, please state your 5-digit physician code." The IVR will compare the physician's input to its database of registered physicians and identify the physician when it finds a match. When a match is made and the physician is identified, the IVR system will ask the physician to confirm the identity using a yes/no query. If a match is not found, or if the PIN is not recognized, the system will return to the physician ID step. Once the identity of a physician is confirmed, they are asked to identify the patient they wish to order labs for. They do this by stating their patient's first and last name. In the case of Dr. Smith, the physician has 2 patients he can identify, Susan Andrew or John Doe. As with the physician identification step, the IVR system will read back the patient's name. However, it will also add the patient's date of birth as a second identifier. It will then ask the physician to confirm the patient selection using a yes/no prompt. If the physician does not identify a patient registered to them or fails to confirm a patient, the physician will be redirected back to the physician's patient selection step. Once a patient is confirmed, the physician is prompted to record their order. They are given 60 seconds to state their order in its entirety. At the completion of the order, the IVR asks the physician if their order is complete. If not, the physician is routed back to the order recording step. If the order is complete, the physician is routed to the last prompt, which informs them their order has been placed and will be entered into the hospital's EHR within 1 hour. Additionally, the physician is informed that their verbal order will be saved to the patient's EHR as an audio file. At the end of this prompt, the IVR disconnects. In conclusion, IVR systems such as Voxio may allow physicians to directly place orders for their patients into a healthcare organization's EHR in the absence of direct computer access. Voxio Developer is a flexible and easy system to use consisting of multiple pre-programmed steps. However, despite the simple design and intended ease of use for novices, programming components are not always intuitive. Step choices which appear logical to use often turn out to be poor selections. Additionally, program steps within components are more easily completed if the user has familiarity with IVR system programming. This concludes the presentation. Thank you for your attention.